Okay, thank you so much for joining us, Megan. We were talking before we hit record about how this is nerve-wracking for us to put ourselves out there and do this, but I think that this is supposed to just be a fun conversation. So let's talk about perineal massage.
Well, thank you so much for inviting me to do this with you, Melissa. And yes, very nerve-wracking, but it's good to get out of our comfort zone a little bit and to talk about different things. And hopefully it'll help to educate people
Yeah.
about perineal massage.
Awesome. So what I really I want to tie in kind of what we both do. I mean, obviously Megan's a midwife and she looks at perineal massage and what that does for her clients in a very different way than I do as a physiotherapist. So let's just kind of get right into the conversation and we'll answer a lot of the questions that I think that you all have. I'm curious to start, Megan, with, are you noticing more talk about perineal massage? I notice it and I wonder, are your clients coming to you with more questions? Are you hearing more about it in your training? Yeah, speak to that a bit.
I think definitely probably one of the biggest fears that a lot of women, a lot of birthing people have when it comes to labor and birth is the potential for vaginal trauma or for tearing during the birth process. I think that's probably one of the number one fears when someone is thinking about what is their birth or what is that going to look like for them. So definitely sometimes when clients do come in to see us, and if there are those fears there, I think talking about perineal massage can be a great way to start to address those fears and to start to get people thinking about what they can be actively doing to help prevent issues for themselves in the future, and also what expectations might be with the healing process and with the birth process itself. I always find recommending like pelvic floor physiotherapy is one of probably my first recommendations to everyone during pregnancy, but also in the postpartum period if someone is recovering from any kind of tear, especially a 3rd or 4th degree tear. I think that's really, really important. But yeah, I would say there are definitely anxieties around what can women do, what can birthing people do to help prevent trauma in the first place. And so that's where perineal massage can be a great topic to kind of just talk about and get people thinking about how they can best incorporate that kind of in those later weeks of pregnancy.
Yeah. Do you tend to, and I want to just make sure that I say, I know every practice is different, every midwife is different, every group is different. What do you guys tend to do? Do you tend to make sure that you bring it up then, or do you wait for them to bring it up to start that dialogue, or do you send them home with specific instructions? I'm just curious to know what your practice is.
No, that's great questions. I think currently in our practice, it's more about just a conversation. So if someone brings it up, or if we're talking about the birth process or what to expect, and it comes up, then it's something that we kind of freely talk about. I am in the process of updating our website now, and so hopefully we'll be adding in some more kind of client handouts, and one of those could be perineal massage. So definitely having this conversation with you is a great way to kind of say, oh, right, maybe that's something that we could be trying to disseminate that information more so to the public or for people to access as well too. But yeah, it's more a conversation, I would say, in our practice right now.
Cool. And what would you say, like, so let's say that you're working with a client and you know that they're doing perineal massage, either I'm sure that it's because they've told you. Would you say then that you make a direct correlation between, oh, they've done perineal massage, this is going to go better? Or would you say that you're like, oh, great to take that in, but I don't know if that will make a difference. Do you know what I mean? Speak a little bit to that. Like if you know someone's doing perineal massage, do you see a difference in the outcome?
Good question, Mel. It's hard to say for sure. If I can say that there's a direct correlation with outcome in perineal tears and someone doing perineal massage, say starting around 34, 35 weeks. More so, I find that there can be a good correlation between just mind-body awareness for individuals. Someone that is aware of kind of the musculature down there, the ligaments down there, what is happening with the birth process as babe is descending through the pelvis and with crowning and the perineal muscles stretching. And someone that's done massage, a lot of that can just help with that mind-body connection. They're more aware of what maybe those sensations might feel like, and can kind of better help with controlling, pushing. So in terms of reducing trauma to the perineum, in my practice, I think a big thing that we try to focus on are warm compresses, potentially perineum massage. It's not going to be for everyone, but for some people it can be really, really helpful. And then just helping to direct pushing, and more so just with the delivery of the head and trying to do a really slow, controlled delivery of the head if we can. Because that overall can just help the tissues to stretch a little bit better, and to reduce the amount of tearing, and that kind of thing. We do know when we look at research and we look at evidence, perineal massage, it can go both ways. It does seem to have some good evidence that supports that it can reduce trauma overall, but it doesn't seem to necessarily reduce, say, the risk of a first, a second, a third, or a fourth degree tear. And it seems to be more beneficial for first-time moms than for second and third-time moms. When we think about tearing or trauma to the perineum, so definitely the muscles and ligaments are one part of it, but also, someone's nutrition is going to play a big part of their tissue integrity and how that tissue actually stretches. And if there's been any trauma, if someone has a history of any trauma at all, that's going to impact their birth experience, and how they are experiencing those sensations and those feelings, as well if there's any scar tissue. So if someone has a history of a third or fourth degree tear, that scar tissue alone is going to impact how that tissue is going to stretch in any subsequent birth. And so definitely a third or fourth degree tear, or someone that has a history of a third or fourth degree tear, I always recommend perineal massage and pelvic floor physio, just to help kind of with that integrity of the scar tissue and hopefully softening of that scar tissue. So that's something that someone could even do when they're not pregnant, so in the postpartum healing process after a third or fourth degree tear, but also in any subsequent pregnancies, going back to that and saying, okay, how can we now prevent another third or fourth degree tear from happening this time around?
I couldn't agree more. And I think that it's definitely made me start looking at the research more. There's been a lot of new research, I would say, lately, and I agree. Like, you come across all sorts of different. I mean, obviously their methods are different and their studies are different, but you're right. Like, when you look at it, oftentimes it'll say, more beneficial for first-time moms, but that you do see a lot of positive findings, like can decrease trauma requiring sutures, decrease the rate of episiotomy, decrease ongoing perineal pain after. I've seen that it can reduce the second stage of labor, but I always tell people I recommend it all the time, whether they're a first-time mom or a fourth-time mom. And because I do spend a lot of the time, as you mentioned, talking more about the mind-body connection, and I say, yes, the research is fairly supportive of perineal massage, that it will do these things. However, will I tell you that perineal massage will guarantee that you won't tear? No. And I always say that my reason for teaching perineal massage is, have you ever touched your perineum? And most people are like, no. And I'm like, do you know what it feels like to stretch? No. And so, like, I've had, especially for first time moms, has anything ever stretched your perineum that much? And they're like, no. And so, being able to kind of feel what that feels like, I think is the most important thing, like you said. And that's what I kind of quote unquote sell people on it, is that I think it's very beneficial to help. The more you can feel that or connect with that area that a baby's going to come out of, that will be what serves you well. And I thought, when I was curious, this is where I want to go with this eventually, is I saw one study that talked about how it could be beneficial during labor. And that's what started making me think, like, I really want to talk to someone that's there, because sure, I tell people this, like, I teach them how to do the massage and the stretching and how to really have that mind-body connection. But I wonder what that looks like when they take that to, their birthing situation. I wonder, what people see. And I wondered if it would be helpful if I just talk through kind of what I teach, because I think that you can see perineal massage taught or described in so many different ways. And I actually teach it a lot different than what I even learned. And so I wondered if I could kind of just walk through what I teach, and then it would be interesting to hear what your thoughts are, how that might apply to, how you guys, like you said, could use it in the actual birth situation. And when people come in, I find that I start first, it's just giving them awareness. Like I said, what does it feel like to tighten those muscles versus what does it feel like to relax? Because, during the birth process, you will be feeling some pain. Like, pain will be part of your sensation, and pain creates a natural tension in our muscles and in our body. That's normal. But now that you kind of understand what tension feels like, and you feel like what relaxation feels like down there, I want you to really be able to kind of get in tune with the relaxation. So they'll first practice just kind of like tighten the pelvic floor. And I always say, tighten the hole, relax the hole, tighten the hole, relax the hole. And then they'll progress to like inhale, open the hole, exhale, open the hole, inhale, open the hole in different positions. So that they kind of get an idea of like, no matter which way I'm pushing or whatever, what position I'm in, I feel what it feels like to be relaxed or soft down there. And then perineal massage is a way I would say is to kind of increase that stretch. Like I describe, when you go into yoga and you go to pigeon pose and you get into that position, you're just like, oh, yuck, I just want to get out of this. Like you just want to move out of that. That's kind of what your perineum is going to want to do. It's just muscle. And it's going to want attention with pressure or with pain, but being able to kind of be there and learn how to relax into it or breathe into it is what you're going for. Right. And so that's where I'll teach them, whether they practice it with, themselves or with their partner, but they learn more than anything kind of how to create stretch or to pull down on that perineum and then sit with it and breathe with it and be able to feel control. And I think that, that's, and then I suggest that they work on that, several times a week. And it's more just so that you have that memory of what that feels like, not because if you do it 5 times with this certain oil, then you will not tear. Right. But, yeah.
I think that's a way to describe it, Mel, just kind of that trying to connect and just sit with it. Like you said, just feeling whatever that sensation is for someone and just sitting with that and breathing through that. And I think that more than anything can really help a woman or a birthing person get through that, especially that crowning sensation as babe is starting to descend through the perineum.
Yeah. And I think one of the things, like when I learned perineal massage, it was a lot of like, come onto it and rub back and forth, rub in and out. They would call it the burning ring of fire, where you'd go kind of from one side to the other, keep going. And I've really moved away from that because I always say, like, what are you replicating? Like, there's no baby that's coming out sloshing back and forth, or that's like, do you know what I mean? So that's why I've taught a lot more. And I found a study that said that the static pressure was better than the moving pressure. And so I've really started to use that just to more like a sustained pressure that you're breathing into. And I think a lot of people have questions around, well, so am I supposed to do it by myself or does my partner have to do it? Which one? Doesn't matter. If your partner is I always say, no matter how supportive my husband was, there was no him staring at my perineum and pulling on it that was going to allow me to relax. Like that was not relaxation for me. And so he was not the best person for me to do it. Whereas someone else might find that their partner creates a lot of calm for them. Mm-hmm. And sometimes people like that their partner can give them the feedback. Like if their partner is actually stretching and their partner be like, oh my gosh, Megan, with that breath, that really opened, or what have you. So I don't think there's a right way or a right position or a right person to do it. Like you said, it depends on the woman.
Yeah. There's no right or wrong when it comes to perineal massage, whether someone chooses to do it or not do it. And yeah, just like you mentioned, like for some people, it's going to be by themselves in the bathtub, maybe doing perineal massage. And for some people, it might be with a partner. And some people, it might be needing that feedback. So whether it's a partner kind of letting them know how things are going or using a mirror or something like that. And yeah, there's no right or wrong in terms of the type of oil or whether you're using fingers or even a dildo or whatever it is that you're using to help stretch that tissue. There's no right or wrong with that.
Totally. And I would say you don't need to use oil. And that's what a lot of people are saying. Do I need to buy that? No, you have probably plenty lubrication during pregnancy. And, I thought of a question that I want to ask you. I get a lot of questions. I recommend the bathtub a lot too, because I think you're already warm and you're calm and it would help you relax. But I get a lot of questions like, is it safe? Like, what if the bathwater gets into my vagina? And I always say, as a physio, I don't feel like can say like 100% sure of this, but Megan, I'm going to put you on the spot and say, like, what happens if the bathwater gets in the vagina?
It's not like your vagina is sucking in water when you have a bath normally. Definitely when you're doing massage, your vagina is self-cleaning. So it's naturally going to just vaginal discharge and mucus would remove anything in there. Obviously, if your water has broken, I wouldn't recommend going into a bathtub and doing perineal massage. But if your water's not broken, if everything's intact and you're 35, 36 weeks and you're having a bath, we know that water immersion during labor and birth can be really helpful for decreasing muscle tension. And as you brought up before, when your muscles are tense, that's going to increase pain. And so it's all about trying to stay relaxed and stay calm. So whether that's someone in a bathtub, because you naturally relax when you're having a bath, that warm water just is going to allow the perineum, that tissue to stretch. And that's sometimes too why, you know, a lot of times I'll use a warm compress for while someone is in that second stage, just to help that tissue. That warmth is going to help the tissue to stretch a little bit better. And so that's definitely evidence-based as well too. Warm compresses and perineal massage can potentially help to decrease tearing. But yeah, there's no right or wrong. So if someone's comfortable, some women say they can't reach, and that's okay. For some people, in the bathtub might be an easier way to kind of reach forward and to reach that area. And for some people, they might need help from a partner, or to be kind of standing with one leg up and reaching that way. Everyone's going to be different.
One of the places I find, because most people will say, okay, Mel, I get it, but I can't squeeze it into my day. Like I just can't get it into my day. And so that's why I find the bath is helpful, because a lot of women will be like, no, I will prioritize my bath at night. But it's hard to take the time to take off your pants, lay on your bed and do perineal massage. And I think it's a big barrier. So I try hard to find, like I said, the bath, or sometimes I just stay on the toilet after you've gone to the bathroom, like just wipe and then sit there for 3 breaths and just pull kind of like the opening of your vagina down towards the anus. You're giving your perineum a bit of a stretch, and then just breathe into it for a few breaths. And because you're already kind of in a position where you have access. Really quick question, and then I want to move on to like how you apply this into birth a little bit more. Can you tell me, Megan, like what's your take? I learned that too, that we shouldn't start perineal massage until 35 or 36 weeks. But when I think about it, I don't understand why. And I actually put this out to a group of physios in a Facebook community saying, I know this is what we were taught, but I don't get why. And most of their response was, as long as it depends on what you're focusing. If people are going down there and trying to reef on their perineum, then no, they shouldn't be, doing that. But if your goal is just mind body awareness, why can't you start earlier? And I wonder if you have any answers to that.
I don't know if there is like a necessary answer as to why not starting until term. A lot of times when we're talking about ways of getting the body ready, it's just something that we would start talking about around that 35, 36 week mark. Definitely around that time, your body is going through a lot of changes during pregnancy. So you're going to have increased circulation in the perineal area, and potentially even some increased swelling just from the pressure of babe in the uterus and extra weight and all that kind of thing. And so there could be benefits to starting it early, but there's also studies out there that say doing a lot of perineal massage actually doesn't decrease the risk of perineal trauma. So I don't think there is any great set point that says, okay, you should start at this point. You should be doing it 3 times a week for 10 minutes a day. There's, again, no right or wrong. When you can fit it in, if you can remember, at the end of the day, around that 35, 36 week mark. I just don't think there's been any maybe studies or research to look at what are the effects of it, say starting right away versus starting in the 3rd trimester, in terms of a safety concern with perineal massage. As long as the tissue is intact and the water is intact, there's no safety concerns to babe. It just might be more uncomfortable or not as beneficial. And so I think most of the research just really looks at from 35 weeks onwards.
Makes sense. So then I kind of picture, again, I always kind of leave them at say 35 or 36 weeks personally. And, we've practiced that. I feel confident that they feel confident that they have like that mind body connection. And then let's say, they're in the actual birth situation. You've already touched on this, but I just wanted to kind of lay it out, that we talked about that perineal massage, and I think of it more as perineal stretch, like perineal feedback, right? And so that would be one way. Like, let's say this woman is like, stalling a little bit, or that baby's having a hard time getting out, that I can imagine that you creating a little bit of stretch in the area where you can see maybe she's being hung up there, right? To be able to give feedback. And please tell me, because I'm more or less I'm saying, but it's more of a question. And I think that what you're saying is that that's one way that you can give a woman some feedback, but that maybe the warm compress would be what helps that area relax, or maybe it would be a mirror that they can see, oh, that's where I need to relax, or just you touching it. So yeah, maybe speak a little bit to like what that would look like dumb it down for me and explain, like, what would you be doing if you were to incorporate like a perineal stretch? Does that, talk me through it?
Yeah, I mean, I think, like we mentioned before, everyone's going to be really different. So it's going to be a very much one-on-one and personal thing, whether someone wants touch down in that area while they're pushing or not. And so that's the first one, making sure that someone is comfortable with touch or with a warm compress, and obviously asking for consent first. But making sure, because during the labor process, it is very much a physical process, but also an emotional process. And you don't really want to be disturbing someone to a point that you're kind of taking them out of that labor trance in a way. And so for some people, massage or that feedback, so sometimes it can be really helpful. So for example, if a woman has an epidural and might still feel pressure sensations and might still feel like, yeah, it's time to push, but might be struggling a little bit with where do I need to be pushing into. Sometimes just applying a little bit of pressure to the perineum in a downward motion can just kind of help to give that kind of biofeedback back to say, okay, this is where I'm trying to put that pressure. This is where I'm trying to direct babe. And sometimes it is just, as a care provider that has been doing this for a few years now, it's going to be different for everyone. And sometimes it's just like in that moment, you're just looking and seeing how is that perineum stretching? Will a warm compress help that perineum to stretch? How is descent going? So how is progress being made? Like you mentioned, if progress is happening naturally on its own, sometimes being more hands-off is going to be better. Whereas if mom needs a little bit of direction or a little bit of help in just guiding babe around that pelvic bone, that's where sometimes either kind of perineal massage or that pressure, or sometimes a warm compress, just that warmth against the perineum is going to help the tissue to stretch, but can also give that feedback loop to a birthing parent to say, okay, this is where I'm pushing into. I want to push into this warmth. But everyone's going to be really individual. For some people, having touch down there is going to get them out of their zone, and that's what you don't want. And so just kind of making it a very individualized thing for each client that you're caring for is really important.
I love that, because I'm such a big fan or advocate for being proactive in learning about our bodies. And again, I love how you kind of mentioned that it's not about how many times you do it, or it's not about exactly how you do it, but just kind of giving yourself the power, or giving yourself the cue so that you feel like you know how to play an active role. And I don't know, I love it. I'm curious to know, Megan, like, let's say, so everybody comes out, obviously we're talking specifically about vaginal birth here, but everybody comes out with some degree of trauma down there, right? Whether you had some tearing or a little bit of tearing, or not any tearing, or a lot of tearing. One of the biggest things that I'm sure that we all teach after is like rest the area and let it recover. And I know that you guys in your practice, it tends to be around 6 weeks that you follow your clients. And so understanding now a little bit more about the perineum and understanding that it stretches, I think a lot of people I always say that they picture their pelvic floor flapping in the wind after. That's what women picture. But generally, what I see as a therapist is a lot of tension, like protective tension. That area wants to really hunker down to give you that protection. And so, and I know that, after people are discharged from your care, they're not always getting that movement back in their perineum. Like you mentioned, that sometimes it can affect their next birth. Or I see a lot of people that come and say, Melissa, like, it hurts to have sex, or I'm peeing when I run. And I'll always go back and look at the perineum and look at the movement in the perineum. And are they able to, like, is it holding on to a lot of tension? And I guess I wonder, how we could, because this isn't something you're going to teach them in the first 6 weeks. You want them to rest. You want them to understand that there's nothing aggressive they need to be doing. But I do think that it's a good idea. And I wonder if you have any thoughts on how we could do a better job of this, because I think that there's a big gap between what they get in their early postpartum care, but then they come in sometimes years after looking for help with a perineum that doesn't move. And I wonder if you have thoughts on how we would take them from that rest period to them understanding that it might be a good idea to reinstate that perineal massage once they're healed down there.
Yeah, and I think that's a great way. I think doing perineal massage for birth is one part of it, but doing perineal massage for actually the postpartum healing after a tear can be really important. And I love how you mentioned just what you notice a lot is tension. And that's definitely, so for a big part of us as midwives, we care for people, women and their families for about 6 to 8 weeks postpartum. So we don't see necessarily a lot of the long-term effects afterwards, but it is definitely something that we try to talk a lot about. So a big part of it is awareness. I think, it's very common for women to have pain after sex, or pain with sex after birth, or to notice a little bit of incontinence after birth, and to notice that things might feel different, like the vagina might feel heavy, or there might be different sensations that weren't there before. That area does change once someone has given birth, but a woman doesn't have to put up with that. And so that awareness around pelvic floor physio, around how best we can actually heal from that trauma, whether it is a 1st degree tear or a 4th degree tear. There are things that people can do to help heal, and a lot of that can come down to, and that's why I do strongly recommend pelvic floor physio to everyone, and even women in their 50s and 60s we're seeing come back with incontinence issues and things like that. So it's things that might have been from their birth years and years ago that are actually, they're having concerns come up 20 years later because those muscles aren't working as well, or there is still that tension or that scar tissue that might be there. And so just that awareness, that knowledge that there are things that we can do, or that there is help out there, that someone doesn't have to live with pain with sex, or live with pain in general, just, or being able to do the activities that they want to get back to. But knowing that it is a healing process, it's not going to be instant. And I think that's, a lot of women don't realize that it is a healing process after birth, and taking those 6 weeks just to rest and heal can sometimes be better in the long term. Going slower in those first couple of weeks, better in the long term than trying to rush back to get back to where they were, to get back to everything that they were doing before that. It took 9 months to grow this babe. It's going to take some time to heal after the birth process, and especially if there's been any trauma to the perineum. A lot of times you'll see, like, the larger the extent of the tear, there's usually going to be more pain involved because there's more nerve involvement and muscle involvement and things like that. So women that have a 3rd or 4th degree tear can be a quite lengthy healing process. And so staying on top of pain, and being proactive in their healing, and getting help as well too is a really important part of that. So I think that's where you and a lot of the other lovely physios here in town really shine, is that after piece, because we only see them for 6 to 8 weeks postpartum.
Yeah, and I think that that's the benefit. I love how you mentioned like being proactive, because I think that's a benefit of someone coming in during pregnancy, is that you can kind of give them that mind-body connection. They understand the anatomy. And so then after, like, and I say, you might very well be very sore and you might have some stitches, but I want you to have a picture of tension, and don't just be doing like Kegels. I want you to be, sometimes I'll say, like, I want you to practice the birth breathing again. I want you to inhale and feel relaxation, exhale, just feel a little bit of connection, like just trying to reinstate some of that movement, because at the end of the day, the pelvic floor can't completely rest after. It still has to deal with bodily functions like peeing and pooping, and it has to become active when you lift your baby. So just kind of reinstating that nice movement. And then sometimes as simple as like just look at the area after and touch around it is kind of a form of easing into perineal massage, right? And so like you said, after it's healed, finding someone that can help you with the specifics. Megan, thank you so much. Is there anything that you feel like we haven't touched on that's important for people to hear?
We touched on a lot of things. So I think we talked a lot about kind of perineal massage, and talked a little bit about tissue integrity and things like that. And again, it's not a one size fits all. There's no right or wrong when it comes to perineal massage. And for some people that might be the right option, and for some people it's not. And so it's just kind of taking it at a case-by-case basis, depending on the client, depending on the person, in terms of what they might need through their pregnancy care or through the birth process. One thing that we didn't really touch on, which isn't maybe necessarily relevant right now, is there used to be products that women could use.
Yes, I meant to bring that up. Yes, please do.
like the Epino was one that I don't think you can get in Canada anymore,
Yes.
but for women that maybe weren't comfortable with massage themselves or with a partner, there used to be devices, medical devices that a woman could actually purchase to help facilitate that stretch. And that kind of goes back more to what you're saying with perineal massage, where it's more that static stretch or that static pressure and not like the back and forth rubbing. But it's just that sensation. So kind of figuring out what are those sensations going to feel like before someone's actually in labor, before someone's experiencing pain. How can they sit and just breathe with that pressure sensation, with that stretching sensation? So yeah, the devices are out there. Some people might have more questions about them, but
Yes,
I know
that's a good point.
it's hard to actually find a manufacturer that's approved by Health Canada at the moment.
Yeah, I'll stick a link to them just in the show notes so people can look. But yeah, there's another one called, I think you say Aniball.
That one.
Yeah, but again, it's not readily available in Canada. Yeah, I think that it can be a tool too. And I think at the end of the day, it's like anything, it provides biofeedback. But at the end of the day, if you're just doing it and not kind of getting that, it's the same as perineum massage. If you're just down there rubbing your perineum, I don't think that you're necessarily going to get anywhere. Same thing as if you're inserting something and not kind of using your brain to connect and sit with it and learn to relax into it. I don't know if you'd necessarily get the results you're looking for. But no, I'm glad you brought that up. I somehow missed it off my list. But yeah, I agree. I think it's like you said, it's not a one size fits all. It's just another tool to help you kind of gain awareness of your body and I think help with the recovery process as well. So
Absolutely.
thank you so much for joining me, Megan. I not only learned some stuff, but I look forward to seeing kind of how we can, I don't know, make it a little bit more holistic and how we kind of make it seamless for people and the clients that we see to see that we all are trying our best to work together to, help them have the best process that they can, right?
Oh, absolutely. And thank you so much for inviting me to talk with you, Melissa. It's been wonderful.
Enjoy the rest of your day.
Thank you.